Yes, yes, yes. Welcome, Maya.
Okay. Namaskar.
Namaskar.
Thank you for having me as one of the speakers on this very important topic today, that is COVID-19 challenges and opportunities. It's not only a topic, but it is something which touches the life of each one of us in a very close and intimate manner. And it is something that, normally in seminars you have issues and problems which do not really directly affect us at times. But here we are in the midst of a problem where all of us are affected by it. We are all confined to our homes right now. And thanks to Corona for that. So while COVID-19 has physically distanced us all, but there are some good redeeming features also. The virtual world has brought us together like never before. So while there are challenges, there are also opportunities. And that is what balances everything out. Usually disasters have an effect on some geographical area or some sections of the population. But today we have a calamity like never before. COVID-19 is unique in that respect because it has impacted each one of the 135 crore Indians. And I would say even the ones who have not come into the world, who are in the womb of their mothers, they will also be facing the after effects of this virus. And it has not only touched the lives of the humans, but in fact, all living beings. So today, we have a situation where the calamity of health has become the calamity of humanity. And the question is, will our lives ever be the same again? Because post-COVID, we will have to deal with a changed societal context. We still do not know how long it will take for the world to get out of the tentacles of this dreaded demon, what toll it will take on our civilization. These are the questions to which we have no ready answers today. There is uncertainty, there is fear, there is anxiety, and this anxiety and fear is multiplied manyfold by this corona news, which keeps bombarding us all the time from all sides, morning, evening, all the time. Now, as we prepare ourselves for this new normal, as it were, some terms have come into existence and become the buzzwords, and one of them is the new normal. So as we are readying ourselves, preparing ourselves for this new normal, one thing is for sure, it is undisputed rather, that today we are going through one of the world's biggest psychological experiment. An experiment for which we have no parallel so far. And all of us are the subjects of this experiment. And all of us will also be paying a price for it. There are so many stresses and anxieties which abound in this lockdown. We are constantly facing the risk of the infection. It's like, who will be the next? That is what we keep looking out for. We are worried, what if we get infected? And the prospect of our loved ones getting affected is even a cause of greater anxiety and concern to us. Not to negate the financial and the economic aspects of this psychological impact that we are having, which can be the cause as well as the consequences. So while we as a nation, India as a nation has shown strong resilience in dealing with the outcome of the virus so far, the uncertainty, creating anxiety and stress in our minds is now getting a little more heavier and heavier by the day. And now we are facing a situation where the fatigue of the lockdown is also setting in. All this make the situation, the ground, very ripe for many mental health issues. accompanied with the mental issues, we cannot look away from some of the very important social perspectives or some of the social phenomena as well. There are many new things which are coming on the scene, which we have not seen so far, of late at least, in our country. For instance, we are facing a new kind of untouchability. For corona, the disease and the treatment have both shocked the average man. Normally, treatment gives you relief, but in our case, the treatment is proving to be causing more anxiety than the disease itself. Now, this dual attack has resulted in a very peculiar manifestation of human behavior. It has worked strange things on the human psyche. The remedy available to us, what is the remedy? The best remedy is social distance. Now, social distance as a social phenomena refers to an individual's emotional feelings of separation between different classes or ethnic groups. As a concept, we understand it in that way. But in the context of COVID, it refers to the measures adopted to minimize contact among people to prevent its spread. So social distance, which is the new buzzword, which used to have negative connotations earlier in the past, is now being perceived as a life savior in the present. So a lot of our concepts are also going for a 360-degree turn. Untouchability we have understood because it has been practiced in a country for centuries together, but in a very different social historic context. But in this corona mayhem, as an outcome of this fear of the infection, a novel form of untouchability has raised its ugly head, which, though is therapeutic, necessary, is a remedy, but at the level of psychosocial health of society may prove to be a pathological condition which needs to be controlled before it destroys us with its serious long-term repercussions. Coronavirus is not discriminating, by the way. It is a big social leveler. For the first time, you have the rich, the poor, the Brahmins, the Muslims, the Christians, the Dalits, the young, the old, who are all in its web. So the coronavirus is very neutral, we can say. It is not sparing anybody. No matter how affluent you are, even Prince Charles got it. So even the world leaders are not out of its reach. So that is one redeeming feature. So while coronavirus is not discriminating amongst people, unfortunately, we as a society are, because the COVID fear is bringing back an untouchability that India has fought for a very long time in a new avatar. Earlier, caste calculated the social distance. Today, occupation and health of a person determine the distance that needs to be kept. Since every person is a potential carrier of the novel coronavirus, the fear can get transformed into real prejudice in our behavior. Now, in this context, I will just like to narrate a few of the experiences, which the people in Indore have narrated. In one of the newspaper report, it was mentioned, and they really give us an insight as to how this disease is affecting the mental and social health of the people. Now, I'm not revealing the names, but this is what the people who have recovered from the disease had to say, the way they are being treated by the social impact is likely to have on these people for a long time to come. One person said, being a corona patient is making me feel like a criminal, as if I were a terrorist. Neighbors have started looking down upon us. They want us to leave the colony and go elsewhere. Another one narrated, when some of the family members tested positive, the people of the colony blocked the way to our home. The milkman, the sanitary staff were obstructed. Even the delivery boy who came to give medicines was denied permission. Another one had another sad story to tell. 3 members of a family tested positive. the delivery boy refused to deliver groceries on the ground, that if others came to know that I am delivering to you, they will not buy from us. So these kind of incidents are creating a situation which is very harmful socially as well as psychologically for any society and will have long-term repercussions. Now, it is not only happening at the village level, but unfortunately, it has gone to much serious levels, because there is another report which is coming from Maharashtra, and it is telling of village boycott, social boycott, which we had heard earlier, that people were boycotted because of their caste. But today people are being boycotted. There is a social boycott because they are seen as potential carriers of corona. So according to some newspaper reports coming from Maharashtra, no one from the cities, including migrant natives, is being allowed into the village. Gram panchayats in several villages have warned residents with social boycott if they led their relatives from cities into the villages. The social boycott will bar the violators, that is, all those who do not follow the diktat of the Gram panchayat. They will be restrained from entry into the common areas of the village, using common wells, bore wells, taps, buying provisions from the local shops. They will not be allowed to attend any social events in the village, and others won't attend their events either. Priests too will not be allowed to perform ceremonies and rituals at their home. Now, all these kind of social behavior is definitely going to affect the mental health of a large section of the population. And managing mental health during and after coronavirus is one of the biggest challenges that face us today. Managing one's mental health, psychosocial well-being during this time is as important as managing one's physical health. The danger is that with the headlines coming from all sides, news outlets breaking news, and our social media feeding us during the lockdown with all kind of news, which may be fake at times, there is a risk of a stress which is being called as infodemic. So you don't only have a pandemic, you have an infodemic as well. Now the stress, the depression, the mental health issues, the time that we have at our disposal will be less to discuss all of them. So I'm going to take only a few of these issues, which I think are of serious concern and immediate serious concern. One is the stress which is related to quarantine. Quarantine, nobody knew about this word. We know that it means 40 days that people are secluded. Now here it is a remedy to keep away the virus, to control its spread. So although it is a necessary preventive step, and quarantine, which usually is associated with negative psychological effects, the dimensions and stress of this vary from institution to home. But today, quarantine is again a savior. But its impact on the human mind can be devastating at times. People are dreading. It's okay if you are quarantined at home, but if there is an institutional quarantine, that itself is putting the fear of life into people. Because you are not sure whether you have this virus at the moment, but people are saying almost sure that once they go to the quarantine center, they're definitely going to get the virus, because there will be others and you do not know who of them will be infected and will pass on the infection to them. Also, it has been found in many studies that prolonged period of quarantine or confinement, as it is, away from the family in an institution or even in home for that matter, does have social, emotional and mental impact on the psyche of a person. There is another phenomena which can be a great cause of stress and depression, and that is the social hostility which we are today finding and seeing around us. We are witnessing a new trend of violence and non-cooperation, rarely witnessed in health. issues or problems earlier. Misconduct and harassment of the healthcare workers, especially doctors, nurses, police, is widely reported. They are the front runners, our protection shield from the virus, and they are being ill-treated. People are being hostile to them instead of showing gratitude to them and their families, because they are the ones who are putting their life at risk. So not only they are being the shield, but they themselves are in bigger danger today to be the victims of mental problems, because the stress of their work, the workload, again, many of them have narrated time and again in the newspaper reports, they are not getting any weekly offs. They are giving their services selflessly to the people, and many of them have got infected, and some have died in Indore also. Some doctors have died. Some healthcare workers have died. Police have died. And on the top of that, if they are to face hostility from the society, this only makes their problem, their stress, more complex. Facing threats of eviction, social ostracism from their own neighbors and friends, own kith and kin, can be a very shattering experience, which will have a long-lasting effect and does not sit very well on any society. So hostility always creates disharmony in society. It results in the weakening of the bonds and creates a lot of mental health problems. Another problem that we are likely to face in the future and facing right now, also in the lockdown, is loneliness. The fear of getting sick is definitely there, but a lonely life, the danger of losing social acceptance, is likely to dominate our identity and lives for some time to come. Prolonged stress adversely affects our immune system and makes us more vulnerable to infections and disease. So here it's a vicious cycle. If you are subjected to prolonged stress, then your immunity levels also go down. So if your immunity levels go down, you become more susceptible to the COVID-19. So this vicious cycle has to stop. There are many psychological issues which have been discussed, which have, from various forums. I will just recapitulate some of them. I've already talked about quarantine stress. Depression and loneliness has resulted in many suicides in our own country. And recently I was reading somewhere in Japan, where the suicide rate normally is very high. In normal times is very high. And with a great difficulty, they had been able to bring it down. It has risen, almost become double during this lockdown and during this pandemic. So where a human life is lost due to the infection, one understands. But when somebody takes one's own life, then you can imagine what is the degree of stress and depression the person may be going through. Recently, we had a case in Indore where a budding TV actress committed suicide because all her dreams of making big in Bombay were shattered, and she was feeling isolated and confined in her home. You can imagine what impact it is likely to have on the mental health of the parents. So there is a rise in suicides because of depression and stress. Now, another very important challenge is for the parents of small children, school-going children, and not to talk of special children. Parental anxiety is at its height. Recently, there was a notification in Indore that the schools will be opened from 1st July. And normally, the parents who are very keen to send their children to schools, they all floated a petition saying, no, please don't open the schools, because we cannot risk our children. Because as long as the children are under their supervision, they can maintain social distancing for them. So children being what they are, whether they will follow the rules or not, and this will put the parents or take them to levels of anxiety which they may not have experienced before. So parental anxiety, especially of small children, school-going children, is touching new heights, and they are the people who would really need help from all quarters, from the government, from the schools, and from the administration to address these anxieties. And of course, not to talk of the economic pressures. Recently, we saw the migrants who had nothing with them coming all over from India to their native places. Why? Walking all the way, taking whatever means of transport. Why? Because they wanted to be within the security of their own place. That was very important. So economic pressures will inevitably result in the worst mental health in the time to come, and will have to be taken care of by the authorities. And many of the white-collar jobs are also being lost. So people, because of economic reasons, there is again one budding actor who committed suicide in Bombay recently because he was having a financial crisis. So financial crisis is also going to lead to a lot of mental health issues in the times of come. Now, stress of the corona warriors, as I told you, they face stress at two levels. They face psychological consequences at two levels. One is that they are dealing with this virus day and night with no rest, no sleep, which is definitely going to take a heavy toll on their mental health. Then at times when you are in a position or seen in a position where you can help others and you find yourself powerless and helpless, for instance, there are not enough facilities to provide beds, to provide masks and other needed supplies. So how helpless these people will be feeling. And even when they are giving psychological counseling, they are likely to get very strongly emotionally involved with the people, which as a helper, they are not supposed to. So they face a double stress, the stress of their workloads, as well as the stress of being at the receiving end of the challenges of dealing with these people who are facing so many problems. So when you see the problems of others, you do get affected in one way or the other. So their own emotions, with their own emotions to deal with, and that of the patients they deal with, they are facing a double stress, and they themselves may be in need of treatment after some time because they are working under pressure. Some of them are working for 2 months at a stretch with no relief, and it is not very good for any society. Now, there are some studies which were done during the 2003 SARS outbreak of the psychological effects of isolation and quarantining. And it was found that many of these people, they suffer from post-traumatic stress disorder, PTSD as it is called. It is an anxiety disorder. And it is specifically the result of being quarantined. So in times to come, even once this lockdown is opened, we are likely to have the real trouble or the real problem will start post-lockdown. The mental health issues will come forward or come out at that point of time. Because right now, we are not getting much information about what people are facing in the confines of their homes. But be sure that these problems will flood us once we are out of the lockdown. And do we have the infrastructure? Do we have mental health workers to deal with all these issues? I'm afraid, considering the population which will be at risk, their number is too insignificant and not adequate. Now, if we see the international responses which have been there to the challenge as against the Indian response, then we find our position a lot more reassuring. Because in our country, and it's a huge country, all activities came to a standstill. All movements suddenly, with one announcement, were restricted. It minimized face-to-face human interaction in just one moment. So what we thought would last for 2 weeks has extended to more than 2 months, and life is not yet back to normal. But let us not look only at the challenges. This pandemic can also be seen as an opportunity to create an optimistic outlook that will require new skills in a society which is transforming itself and increasingly facing multiple challenges. Since Corona is a global concern, we can make multi-country comparisons to see how we as a developed country have dealt with it and how the so-called developed nations have battled with this virus, so that we can make a comparison as to what has worked and what has not, which can be crucial in selecting new strategies to enhance skills into the scope of our dealing with this issue. Finally, this pandemic actually presents us with a case study of how we as a nation have coped with this complex issue. And I hope that our society has evolved. It has faced this crisis, and I am sure it will come out much stronger than it was in the pre-COVID era. Because one thing which we have seen is that it has united the country. It is a big social leveler where we all find ourselves on the same ground. And the united efforts of India as a nation in dealing with almost a war-like situation, I think it is commendable the way we have tackled our nation. Our Prime Minister had the vision to set a stage to prepare us, to unite us on a social and psychological plane. And he too carried out some psychological experiments of which we were a part and a witness to. The chanting of the mantras, the ringing of the bells, the beating of the thalis, all together at one time definitely generated a lot of positivity, and it gave us a lot of mental strength. Also, when the diyas were lighted, these experiments were actually in the social and psychological domain. So now to conclude, my time is up. Hello? Hello? Am I audible?
Yes, ma'am. You are audible. Very clearly, you are audible.
Okay. So I will just conclude since I think my time is...
No. You can continue, ma'am. Okay. You can continue. You can continue.
I can. Okay, fine. Now, I think what we need is really a positive shift. There is a lot of negativity which is doing the rounds, and that is present in any situation that anybody faces. There will be positives and negatives. There will be pluses. There will be minuses. There will be pros. There will be cons. I think time has come to shift the narrative away from the number of deaths to the number of recoveries. Because if you see, in India, the deaths are much less than the recoveries. That is a very, very reassuring fact. And that needs to be shared. And that needs to be, communicated to the people by large, so that this fear which they are having can be allayed. And also the kind of language at times being used, which is a very pessimistic, very negative language. I think we should do away with those terminologies, which are creating fear. And this is a time to come together, to generate hope, to alleviate fear. And every citizen needs to come together and fight unitedly. And this kind of united fight can help us overcoming most of the challenges, because as they say, it's all in the mind. The mind creates its own hell and its own heaven. And it is the mind which creates the fear. So if we do not allow ourselves to be dominated and emerge stronger out of these fears, then definitely we will win as a nation, as a country, over this virus and set example for other countries to follow. Of course, along with that, there is no denying the fact that we do need in a presence of a mental health and psycho support systems, which includes psychiatrists, psychologists, social workers, to deal with this problem on a more scientific plane. Of course, because in the lockdown, we cannot directly face to face. The problem is that one who needs help. Hanji.
Okay, ma'am. You can continue, ma'am.
Okay, I'll just conclude. Not a problem.
Okay, ma'am.
So we today, we also have to try new ways, new innovations. And as we are, doing this webinar has been an outcome of this lockdown, because seminars are not possible anymore. So human mind is very adaptable, and we will find ways and means to score our victories, our little victories over this virus, which we are already doing. So we may need in times to come remote psychological interventions, because the problem is that the one who is helping is also afraid, and the one who is receiving help is also afraid. And as a result of that, maybe staying away, keeping a social distance, we will have to, through the internet technology, give help people to those who need the most time. So interventions that are dynamic, that are adapted and suited to the different stages of the epidemic during and after the outbreak will have to be introduced. Any? Okay. These are some of the things I just wanted to put. There is a lot to say, but then there is a paucity of time, as I understand. There are other speakers waiting. A field which is open to a lot of discussion. The challenges are there, but so are the opportunities. So, okay, thank you so much.
Thank you, ma'am. Thank you very much.
Namaskar. Dhanyavad.